Hey guys, welcome back to part 2 of the Rotator Cuff series. Again, my voice, sorry, got a little bit of allergies going on, so it's gonna be a little raspy, but hopefully you'll still get the information through okay. So if you remember from our last video, we talked about the anatomy of the rotator cuff, the shoulder itself, and why it's so important and what it's really used for. Today we're gonna go over the most common injuries, why they tend to happen, and then what you can do at home and what we would do here to actually help you as well. Kind of a caveat to start, the rotator cuff, there's so much stuff that goes on in the shoulder that if you do suspect you have a rotator cuff injury, make an appointment, give us a call, come and let us assess you and diagnose you properly exactly what's going on, and we can give you a complete program to actually get you back where you need to be. With that being said, we'll go over some ways you can help strengthen your rotator cuff and try to prevent some of these injuries as well. So remember, we talked about the sits muscles, right? Supraspinatus, infraspinatus, teres minor, and subscapularis. And each one of these muscles does a different movement to help protect our shoulder. So when we're dealing with rotator cuff injuries, there's really two types that we tend to see here in the office: acute and chronic, right? So acute injuries are injuries that happen pretty quickly, usually from some sort of trauma. The most common one that we see is actually the supraspinatus muscle, and usually it's in a population that is more fall prone, right? So someone who's walking, they trip and fall, they go to catch themselves maybe on like a banister or railing of a stairs, they grab and their arm gets yanked upwards. Remember, we talked about supraspinatus doing this lifting, abduction of the arm. If it gets lifted too much, it tries to resist and can actually tear that tendon in there. So that's probably one of the most common injuries that we see from an acute standpoint. But really, any of these muscles can become torn or damaged in an acute traumatic incident. Just depends on what that mechanism of injury is. The second one that we tend to see more common, actually, I find, is these chronic issues, right? So this is from chronic degenerative changes that are in the muscles. Just like your bones and joints can undergo degeneration, or what most like people call arthritis, we can actually get degenerative changes within the muscles themselves from lack of use and overuse when they're not properly trained. So chronic injuries and chronic tears to these muscles is very, very, very common. And it can really happen to any one of these muscles as well. So what can we do to help prevent it, right? Well, we need to understand what's going on. With our rotator cuff, right, it's usually weakened, right? We're not really specifically training these muscles. Even if you do work out and go to the gym, we rarely spend time to actually get these muscles going. What we do like to do a lot of is the big, heavy compound movements. And usually it consists of bench press, chest, lat pull downs, right, things like that. And if we look at our daily lives, what are we mainly in? Right, we're sitting at a desk, we're on our phones, on our computers, reading books, on our chairs. We're stuck in this internal rotation, right? So if we think of our big muscles, we have our big pec muscle, we have our big lat muscle, and you actually have a big muscle here on the back of the shoulder called your teres major, right? And all three of those muscles do internal rotation of the shoulder. So this internal rotation puts the shoulder in a really compromised spot where the rotator cuff is trying, and specifically these muscles on the back, to try and keep it back in external rotation. Again, the shoulder wants to, the rotator cuff wants to keep your shoulder in proper alignment whenever it's moving. And so if we're getting over-dominated internal rotators, these extensors are not going to be very happy, and they can chronically get inflamed and get damaged through there. So we want to really work on to strengthen these external rotators with exercises. I love using a band because we can actually get chronic, constant tension on the muscle and really keep the muscle engaged the entire time. Very simple one that we'd like to do, something called a Brugger exercise. This is a really good posture-based movement, but we can also get some rotator cuff work as well. So you're gonna take a band, you're gonna place it between your index finger and your thumb. You're gonna wave to your friend, you're gonna wave to yourself, you're gonna flip the band back between your index finger and your thumb, and you're gonna wave back to your friend. Now the band is locked in place. I'm gonna keep my arms tucked by my side. I'm going to extend my fingers, I'm going to extend my elbows, extend my shoulders, and then externally rotate or bring my palms up. And I'm going to reach as far as I can, feeling the squeeze between my shoulders and in my rotator cuff, and then return. So really nice, simple exercise just to get these muscles kind of turned on, wakened up, and just feel what it feels like to get engagement in some of these, especially external rotators. So you could do this for time, right? Maybe set a 30-second timer or do 3 sets at 12, whichever one feels more kind of right for you, but just something to get these muscles to awaken back up. The next exercise we're going to do is called an IYTW, right? And this is a good one to get the shoulder moving in proper form. So we're going to hinge at our hips, making sure that we're keeping our back safe, so we're loading through our legs, and we're going to do our IYTWs. So we're going to go I, straight ahead, holding, coming down, Y, about a 45-degree angle or so, T, all the way out to the side, and then W. Right? And then you can just kind of repeat this movement here. Again, 3 sets of 12, 30 seconds. Everyone feels good for you. Just coming through that area through here. Next, we can take this band and actually get a little bit more resistance, a little bit more strength built into if we do a couple other movements over here. So we're going to walk over. You can use a band. You can also use a cable machine at a gym, but you want to anchor it to something at around 90-degree angles. This door actually works perfectly for me because my arm is bent at 90 degrees, and I can really make sure I'm working my rotator cuff effectively. So I'm going to get a good grab on the band. I'm going to keep my arm at 90 degrees and my wrist in a neutral state. I don't want this moving at all. Elbow tuck on my side, and just here with the band at just like no tension, just where it's at, I can already feel the backside of my arm engaging. This is working those external rotators of the rotator cuff. And we're going to work it in an isometric state. We talked about that in our previous videos. It's a way that we can start building strength without irritating some of the tendons. So this actually can help without making the pain worse. So we're going to hold our arm here, and I'm going to take a step out. Now, got a little bit more tension on the band. Again, the band wants to pull my arm into internal rotation, but I have to use my rotator cuff in order to keep it into external rotation or in a neutral state. So again, hold this maybe 5 to 10 seconds. Take another step out. Now, as always, when you're doing exercises, but specifically isometric exercises, we want to breathe, right? Breathing in and out. If you don't, you can actually spike your blood pressure. So make sure you're breathing the whole time when you're doing these movements. And the goal here would be to walk out as far as you can go while still maintaining proper alignment of your arm through here and feeling that muscle engage. And then afterwards, we'll come in nice and easy. Again, holding about 5 to 10 seconds at each interval. And I like doing 3 sets of 10 to 12 on these just to really get this rotator cuff fired up. And then you can switch, flip the other side, work the other arm. Another movement that I like to do is kind of working 2 movements in one. We're going to get retraction of the arm and some external rotation. So for this one, for this height, you could do it standing, but it actually works really nice for me on a tall kneeling stance. So my arm's out. If you had 2 bands, you could do 2 at the same time. But for me right now, I'll just show you with 1. We want to keep our arm perfectly flat and parallel with our shoulder. And we're going to keep our elbow tucked back and in line with the shoulder too. So I'll show you what that looks like. For the first part of the movement, we're going to retract the arm. If you see, my elbow is behind my shoulder, so I'm getting retraction, but it's also in line with my shoulder, right? I'm not dropping it down or up. I want to keep it nice and straight with it. Now, you can start with just this movement here, feeling comfortable, getting comfortable with this exercise. The next part, though, is where we get a little bit more rotator cuff involvement, and that's going to be adding an external rotation. Again, keeping my elbow in line with my shoulder, I'm going to externally rotate my hand. Now, what I want to do is keep my elbow in line with my shoulder. What we don't want to see is this. All right, see how it's dropped down below? This actually puts a lot of strain. This feels very uncomfortable. Does not feel good. It's not really working the muscles that we want. I want to keep the elbow nice and in line, pulling back, coming through. And again, 3 sets of 10 to 12 with this movement. Now, there are a ton of rotator cuff exercises you can do out there. These are just a few that I like to provide in the office, and we can show you a whole lot more depending on what condition you actually are experiencing. We also like to do dry needling for the rotator cuff. We can place needles into specifically the supraspinatus and this infraspinatus and these teres minor. That tends to respond really well. Connect it to our TENS unit, get a muscle contraction to help really improve blood flow, and get those muscles to relax a little bit. And Shockwave works great. We've actually used Shockwave for pre and post surgery. So we've had people who have go and had rotator cuff repairs, and 6 to 8 weeks leading up to the surgery, we'll run our Shockwave over the area, helping improve blood flow and getting that tissue ready for surgery, call it prehabbing. And then 6 weeks post-surgery, once everything's healed, we can actually run the Shockwave over this area in order to remove scar tissue and help improve the healing process, getting back to normal range of motion. So these are just a few things that we can do here at home and in the office to help you if you're dealing with any kind of rotator cuff or shoulder issues. Like I said before, make sure you schedule an appointment to really get properly examined and diagnosed, because there's so many conditions that can be caused or can be involving the rotator cuff. We want to know exactly which muscle group, what's going on, and what your tolerance level is for the treatments. But hope you guys enjoyed these videos. Like I said, if you're looking for anything specific for a condition or something that we may help with, drop a comment down below. We'd love to help you out with that. If you and someone you know is experiencing any rotator cuff issues, right, make sure you give us a call, book our appointment online, americansportandspine.com. and make sure that you guys keep healthy, keep active, be kind to your body. Remember, you don't just have to live with the pain. There is a solution. So hope you guys have a great day. Catch you next video.